Okay, so if we're looking at sleeping position for your lower back, then we either want to have you on your side or on your back. There really is no good way to sleep on your front, predominantly because it's not very good for your neck, but it's also not good for your lower back as well. So you tend to stay off the side of pain. For example, if you have left hip, left buttock, left low back or left leg pain, then ideally you would sleep on your right hand side as we have here. The other thing that we want to do is support through the knee and through the hip. So nice thing to do with this is make sure that the pillow is in between the knees and the ankles. What we don't want is just to have support in at the knee. Then what happens is that the leg twists, and you'll see you get that rotation through the hip when that happens, and we don't want that to be the case. We want the leg to be nice and parallel and nice and supported. And if the pillow is between the knee and the ankle, then that is exactly what we get. So if we have the legs nice and parallel, we have the hip nice and pelvis, which means the back is nice and neutral and supported, this is a great sleeping position when you're on your side. If we've got you on your back, I'm going to pop you onto your back if that's all right, then what we can do is put some support underneath the knees. Sleeping flat out on your back is not a good position for you to be in. It tends to hyperextend through the base of the spine and jam up or lock the joints through there. So we want a little bit of flexion through the hips and through the knees. This is a little bit low, so you've got very little flexion here. So if you want to support both knees, what we would ideally do is pop 2 pillows under here. So it's really quite comfortable. And we've got a nice bit of flexion through the hip, through the knee, which puts these joints into a neutral, supported and comfortable position. If you don't have 2 spare pillows, then what we can do is just fold 1 pillow around and support 1 knee at a time. For example, again, if you had left-sided problems, you would support the left leg and you can keep the other leg nice and flat and neutral. Because the left side is flexing through the pelvis, it will tend to hold this side in a good position, and that's what we're looking for.